John and Ken Show. John Cobell and Ken Shampoo, welcome to the program.
Yeah, welcome. All right. Don't interrupt me because I worked on this for a while. You ready?
Okay.
Today, and everybody knew this morning, that the president was going to hold a news event in the Rose Garden at the White House. We thought, at least the headlines told me, talk about all the trouble with the federal website for Obamacare, which is healthcare.gov. You know what the first thing he said was?
What?
I beg your pardon, I never promised you a rose garden?
He didn't say that. Prove he said that. He didn't say that.
Just want to get a song in there. No, instead, he once again blamed it on so many people trying to access the website. And he spent most of the half-hour or so event touting how wonderful life will be, and standing behind him was a collection of people that allegedly did purchase insurance through the Obamacare website. That's kind of what he did. We have some audio to play, which is only a minute and a half of a 30-minute news event. It went on so long
because most of it was just an infomercial spiel.
A pregnant woman behind Obama started to faint. She had to be propped up, including the president took a hold of her to try to help her as she was clearly getting woozy and about to go down. So let's play this piece of audio.
The Affordable Care Act is not just a website.
It's not.
It's much more.
It's a disaster.
For the vast majority of Americans, for 85% of Americans who already have health insurance through your employer or Medicare or Medicaid, you don't need to sign up for coverage through a website at all. You've already got coverage. What the Affordable Care Act does for you is to provide you with new benefits and protections.
The sirens?
That have been in place for some time.
The liar sirens.
You may not know it, but you're already benefiting from these provisions in the law. The point is, the essence of the law, the health insurance that's available to people, is working just fine. In some cases, actually, it's exceeding expectations. The prices are lower than we expected. The choice is greater than we expected. But the problem has been
sounds like a truck backing
that the website that's supposed to make it easy to apply for and purchase the insurance
time to go now.
Is not working the way it should for everybody.
Yeah.
And there's no sugarcoating it. The website has been too slow. People have been getting stuck during the application process.
And you had 4 years to create this, buddy.
And I think it's fair to say that
what have you been
nobody's
doing all
more
day?
frustrated by that than I am. Precisely because the product is good. I want the cash registers to work.
Yeah.
I want the checkout lines to be smooth.
How hard is it to set up a checkout line?
So I want people to be able to get this great product.
Yeah.
And there's no excuse for the problems. And these problems are getting fixed.
Yeah. You know what? They think
in
it's
just a couple of hours, it'll be 3 weeks old.
3 weeks? If it hasn't been fixed in 3 weeks, they're really screwed. How
many people would keep returning to a website for 3 weeks if they can't get what they want out of it?
Nobody. No, nobody. It's over. They admit there's 5 million lines of code that has to be rewritten. They literally made 5 million mistakes. Seriously. 5 million mistakes. Absorb that for a moment.
And this talk about how it's just because the website is overwhelmed. I mean, they're now claiming 19 million people have looked at the exchange since it started. But again, they will not give out numbers on exactly how many people have enrolled.
Because it's very few. All those statistics don't matter. That's all propaganda. That's all manufactured nonsense to divert people's attention from the truth. And the idiot reporters keep reporting it. Oh, by the way, you talked about those human props that were standing next to him.
Behind him, yeah.
Yeah, behind him. And I guess people were supposed to think these were happy Obamacare enrollees. According to National Review, of the 13 people who stood behind him during the speech, few have actually enrolled.
Yeah, one woman spoke at the beginning.
For one example, Malik Hassan is looking forward to enrolling, according to a White House email. Carmel Allison recently began researching her options. Nathaniel Hajnaki is planning to enroll. White House email said that one of the few guests who did enroll, Zori Abolfazli, was able to register last night. So they found one of those people for sure. actually enrolled. The rest of them are thinking about it, would like to, maybe down the road, I don't know, but I'll stand here and play pretend for the Obama propaganda machine.
Reports have surfaced that the exchange is not working well for people who are employed and actually have job-based coverage, but they wanted to go to the exchange to find out if their employer-sponsored insurance is too skimpy or too expensive for them. Apparently, it really was designed to work for people that have not had and do not have any health insurance at all. You noticed Obama in that little clip we played did talk about, things are already good for those of you who have employer-sponsored health insurance. But there are people who wanted to shop and just see if they can get a better deal somehow. Because, most employer health insurance is not free. You got to pay.
Right.
You pay and they pay.
I mean, that's natural. They're hyping this as everybody's rates are going to go down. So why wouldn't you go and check to see if you could get a better deal?
The website also apparently is giving inaccurate information about the federal tax credits that will help most people pay for a health plan. That'd be the subsidy, your money. It's giving out wrong information. It's sometimes erroneously telling low-income people that they're not eligible for Medicaid. There's a lot of problems.
Well, there's 5
it's
million.
Not just because too many people are looking at it.
There's 5 million mistakes there.
5 million
mistakes. If there's 5 million mistakes, you're going to have 5 million different reasons why it didn't work.
Well, if 19 million people looked at it, then it works for 14 million of them.
No, because everybody needs the same 5 million mistakes corrected. So the story is that some reporters have ferreted out, and not just the knob slobbers, is that
there that is again.
Is that the White House was Obama and his top administrators were completely blindsided by this. They didn't know that they were screwed, that the system was screwed. That's the inside story. Well,
remember the story a week ago was that testing wasn't done.
Yeah.
Well, how are you going to know if it's not going to work if you didn't really test it properly?
Yeah. If you're running a company, if you're a CEO like Obama is of the government, none of his underlings told him. If you believe this, I don't know, maybe this is another spin story to kind of... Actually, it doesn't insulate him. It damns him even worse. How could the guy not know that his signature achievement was a complete fiasco? How could he not know? They're trying to say that nobody wanted to break the bad news up the supervisor chain, that nobody told this person who didn't tell this person who didn't tell that person. So no, it never got near Obama. Because nobody wanted to break the news that the thing was screwed. Because they obviously people knew, and they should have said, it's not ready. We're going to roll this out in 3 months or a year or whenever. You can't roll it out until the day it's ready. You can't.
Well, a new poll that came out, 56% think it's not just flaws with the website traffic. They believe there's a bigger problem with the health care law.
There is. That's the truth. That's the absolute truth. And they keep spinning this nonsense, and they keep doing Obama infomercials. I have such contempt. I have so much contempt for the way governments, corporations, really any public institution, public figure handles this kind of stuff. They just deny everything and change the subject and start pumping out the BS gas. That's all they do.
The political types are worried, not that we are, that this could affect the 2014 elections. If they don't clear up these glitches, if they don't get this thing running smoothly in less than a year, it's going to have a severe impact on Democrats' chances at the polls because people will take out their anger over all the mess with this.
There should be a severe impact.
Although, as you pointed out, it's only 15% of the country doesn't have insurance. So
no, but it's $635 million of everybody else's money.
You're right.
You know, the bottom 47%, as Mitt Romney correctly said, are not paying taxes into this. All right? But the top 53%, we're paying the taxes. Yeah, this is what we get? I'm supposed to feel sympathy for the bottom 15% when they stole my money for a system that is a complete dog? It's a complete fiasco? Why should I be paying for this? Why should anybody be paying for this? I get up in the morning to go to work just like everybody else, and we got to hear about, you're not compassionate enough, you're not sensitive enough. It's like, well, if you're going to take my money to spend it on compassionate, sensitive programs, could you have the stinking thing work? Could you find a way not to make 5 million mistakes?
All right, when we come back, another school shooting, this time in Nevada.